So joining us this morning to discuss these new COVID protocols is the co-chair of the mayor's COVID Task Force and chairman of Somos Community Care, Dr. Ramon Tallaj.
Good morning to you, Doctor. Thank you so much for being here this morning on such an important morning for New York City.
Good morning to you, too.
Good to see you. So as the co-chair of the mayor's COVID Task Force, I guess, did you have any input on the lifting of the mandates and creating what is known now as this new COVID alert system, this color-coded map, really, that will tell people where exactly we're at in terms of infection rates?
The reality, we've been working with the mayor while before even the task force was instituted. We're trying to create creation of the task force. But the mayor's team is making the decision based on science. As you say clearly, lower numbers, but not only lower numbers, the trend of this lower number in hospitalization, new cases is important. Still, you should remember that even one case around means that the virus hasn't been gone. Still could change. We have to maintain our very vigilant to be sure. What's important now is to bring the city back. New York is back on this, and New York needs to try to come back to normal, but certainly virus surveillance will remain, getting testing everywhere that we need to do it in order to see how the behavior of the virus could change.
Yeah, I mean, the stats are good. The current COVID stats across the city are really promising, and they show a steep drop in the number of positive cases over the last 3 months, but there's still the risk of new variants. So how is the COVID task force preparing for that possible threat?
Well, there's no question that that could happen. But using preventive care, using, as I said, virus surveillance is very important. We still have to continue vaccination. That's the key of all of this. Keep doing vaccination. We're still not there. Even with 90%, these people who want vaccine, we are not there yet. It's only 77% fully vaccinated through the city. We must do better. We need to do health equity in those neighborhoods because it's not there yet.
Yeah, so when you say things like we're not there yet and that there needs more work to be done, you know, I think some people would feel more comfortable dining in a restaurant where they knew everybody was in fact vaccinated. So is it too soon then to have dropped those mandates altogether, since you're saying we're not there yet in terms of vaccinations?
Mandate is one thing. If you want to continue bringing the city back, that New York is open, we have to put an example. Those people who feel that they still could get sick because they have not been vaccinated, or because they have certain diseases, even being vaccinated, you know, suppress the people with diabetes, you should continue using the mask. The mandate is lifted, but you still could use it in those places. If you feel that you're one of those groups who are highly more possibility to get sick with this virus.
Yeah, and you talked about disparities. So Somos was on the front lines of the pandemic, particularly when it was clear that minority communities and underinsured New Yorkers didn't have the same access to testing and vaccines. So have those numbers improved at all, or are there still communities that are lagging?
Without a doubt, they have improved. Working with the governor of New York, Huckle, and now with Mayor Adams, has improved, but still lag behind. Health equity is not there. Preventive care is the clue. The number has improved, but still not there. We must do better, and especially in our neighborhoods. We are not in the same position like the Bronx or Brooklyn, like fully vaccinated compared with the whole city.
Right. How will the role, sir, of the COVID task force really shift now that the COVID restrictions are easing up, right? Who determines, I guess, what color code we are actually in at any given point? Is it the task force?
Well, we're working with the mayor's team. Remember, the mayor team that William Ison and the new commissioner have said, they are the one looking at the science. And we sit down together in the task force and we make decisions. Certain issues very important in the task force, like why do we start doing the feeding in the school, different options because of obesity. And obesity was one of the main killers during this pandemic to the people who were obese, died the most. Why are we changing health equity? Why, for example, in people like, even example in preventive care, like in the Bronx, we still continue talking about the dust and the mold in our neighborhood, in our buildings, and the communities of colors, because asthma is so prevalent in those places. But nothing has been clearly done. This task force is intended to make some changes, especially in those neighborhoods. At the same time, bring the city back with better, better position for those essential workers that die the most lost everything the most in those communities of color.
Well, Dr. Tallaj, we really appreciate you taking the time to speak with us this morning as we enter what everyone is calling a new normal. Thank you so much.